And the time now, 9:13. Welcome back to Fox 8 Morning Edition at 9. Well, according to the American Diabetes Association, there are approximately 500,000 people in Louisiana with diabetes and more than 100,000 they don't even know they have it. Many of us might not even know what to look for. It's National Diabetes Month, and Dr. Sarah Schwertner, she is here to join us with thoughts and myths about diabetes and what it is. So let's talk first of all, Doctor. What is diabetes? I mean, we always hear about it, but what is the true definition of diabetes?
So diabetes is a very common and chronic condition, especially in Louisiana. There are two types. Type 1 is when your body stops producing the hormone insulin, and type 2 is when your body becomes resistant to your hormone insulin. Type 2 is pretty common in families. It's more common to get it if your parents had it. Also, you can have diabetes with no signs or symptoms in the beginning.
So with that in mind, what do you need to do to make sure that, although no symptoms and you're feeling fine, but if you have pre-diabetes, there are some things that you can do and change maybe in your diet or exercise to stop that so you don't get diabetes in the future?
Right. So one of the recommendations is if you're overweight between the ages of 40 and 70, you should get screened for diabetes. Pre-diabetes is when your blood sugar is high, but it's not high enough to have diabetes. And so with prevention, speaking with your physician about ways that you can manage your blood sugar, you can prevent developing diabetes.
So when it comes down to it, people who may be pre-diabetic and don't know it, I mean, the best screening would be, I guess, blood work. I mean, what should you do to stay on top of it? At least get a baseline of where you are, and in future years you can kind of go off of that baseline.
Yes, so there is a screening. The hemoglobin A1C is one of the tests the physicians can do. You can also avoid eating sugary foods, foods with high carbohydrates, processed foods, or excess calories. And in Louisiana, we love our snowballs. We love, rice, pasta,
Sure.
all the starchy foods. And if you eat those in excess, you can develop diabetes down the road.
So is there any particular class of people that are more prone to diabetes than others?
Yes, so there are many ethnic groups that have a higher chance of developing diabetes. African Americans, Latino or Hispanic Americans, Asian Americans, Native Americans, and even Pacific Islanders.
Interesting. So different people have different ways, I guess, the body processes things, and really, a lot of it too is genetics. Is that right? And so many times where I have friends or family members that have diabetes, and their aunt or their uncle or somebody down the line had it, and eventually they may get it. I mean, they're at a higher risk, are they?
Yes. So definitely in the family, it's very common. Type 2 is actually the genetically passed form of diabetes. Type 1 is not. So if your grandma and mom, your cousins, that they're walking around with their insulin or they're walking around with their diabetic medication, you want to make sure that you follow a low carb, low sugar diet and exercise so you can prevent that.
Absolutely. So around here, a lot of people, we love to eat, as you mentioned, our spicy foods and our pastas and all the different things. But I guess the key is just get checked and, keep up with it. And that's the best thing you can do. Diet, exercise, of course. My doctor preaches it all the time. So, well, doctor, thank you very much for educating us on Diabetes Month. And, of course, hopefully people will get a lot out of this and, help with their diabetes situation in the future. Thanks again. We appreciate you joining us.
Thank you for having me on the show.
All right.